Welcome back. It's Medical Monday, and today we're talking about breast reconstruction surgery with East Cooper Medical Center. And East Cooper is the ABC News 4 hospital expert, and Dr. Patrick O'Neill is here to discuss the options when it comes to this type of surgery. Welcome to the show.
Well, thank you. It's
so
good
to see you. It's been about 3 years or so since I've seen you, but much to my surprise, so good to see you again. What is breast reconstruction when we're talking about this particular type? It's not like a mammoplasty or anything like that, or?
Correct. Yes, it's not like a breast augmentation or a breast reduction. It's typically after mastectomy for either breast cancer or someone who is at high risk for breast cancer.
Now, who would be a good candidate for something like that? Because even though aesthetically and, you know, for looks, for all outward appearances, for the lack of a better way to say it, most people have it done, but not everybody chooses to have it done.
That's right. And so not everybody is a good candidate for breast reconstruction, but most women are. The only patients that would not be good candidates for some type of breast reconstruction are those who are relatively ill or have many other medical problems or have a lot of difficulty healing.
So when you say that with difficulty healing, about how long does a process like this take?
Sure.
Is it usually just one particular procedure, or is it multiple?
Right. Well, most of the times it takes multiple procedures, and depending on the technique and how things go during surgery, it takes several procedures over the course of about a year, usually, to achieve a really nice reconstruction with all the final details.
Now, when you talk about techniques, what types of breast reconstruction options are there out there that exist?
Sure. Well, we have a number of different techniques, and actually there are a huge number of techniques. So I like to, when I talk with patients, to boil it down to 3 basic options that we can do with surgery. One is just closing the breast without reconstruction. The second is an implant-based reconstruction. And the third is using your own body's tissues for reconstruction. And depending on the patient's desires and preferences, we can do any of those 3 types of reconstruction. And of course, to use your own body's tissues, you have to have enough extra tissue somewhere to steal it and replace that.
Now, besides the first option that you said, and it's just to close the opening and not do anything, with the other 2, is there some type of maintenance involved over the years that they would have to come back in if they choose to have it touched up?
That's a very good question. Typically, once you're done with the reconstruction, nothing is needed to be done after that unless there is a need to. Implants, of course, can rupture, they can move out of position, they can have extra scarring called capsular contracture, and all of those things can cause you to need additional surgery. And that is, over the course of 10 years, about 25% of patients need additional surgery after implant reconstruction.
Okay.
Using your own body's tissues, it's less than that. We don't really know exactly what that number is, but it's certainly less than that.
Absolutely. Okay. And finally, what are some risks and, of course, costs of breast reconstruction? Because there's some things that the patients, they need to take that into consideration before moving forward.
Absolutely. The risks of operation of any type of breast reconstruction are wound healing issues, infections, bleeding, all those normal risks, implant ruptures, implants moving out of position, scarring, those sorts of things. And we go over those in detail with the patients during the preoperative process. As far as costs go, it typically is covered by insurance, which is a good thing because it would be very expensive without it. And typically between the mastectomy, the cancer treatment, and the reconstruction, it certainly goes to your out-of-pocket maximum for the first and usually the second year as well.
All right, Dr. O'Neill, thank you so much. Some great information.
Great.
Good to see you.
Thanks.
All right, take care. Remember, you can visit abcnews4.com/experts for more information on this topic. Stay with us. Much more Lowcountry Live after the break.